I would like to start today with an update on the progress of COVID-19 immunization in British Columbia. As of today, 74% of adults, so people over 18 years of age, have received their first dose of COVID-19 vaccine, and 72% of all eligible British Columbians, so everyone over 12, has received their first dose of vaccine. This includes 39% of youth, 12 to 17, who have received a single dose of COVID-19 vaccine. As of today, again, 3,635,795 doses of one of the three COVID-19 vaccines have been administered to people in British Columbia. Of these, 314,246 are second doses. Today, people who received an AstraZeneca vaccine as their first dose will start to receive invitations for their second dose of that vaccine. As you know, the period between doses has been shortened to 8 weeks, which means that many people will be able to book their second dose earlier than originally anticipated. British Columbians are doing very well with immunization against COVID-19, and the results are very encouraging. We are now at step 1 of the restart plan, and we're continuing to follow important indicators of the effect of COVID-19 on our communities. So what are those indicators telling us? Over the weekend, 481 individuals in BC were diagnosed with COVID-19, 218 from June 4th to the 5th, 131 from the 5th to the 6th, and 133 from the 6th to today. By health authority, that's 70 diagnoses in Vancouver Coastal Health, 285 in Fraser Health, 9 on Vancouver Island, 101 in Interior Health, and 15 in Northern Health over the 3 days of the weekend. We now have had 141,663 British Columbians ever diagnosed with COVID-19. At the moment, 2,102 of those individuals are considered to be active cases. As of today, there are 199 people still remaining in hospital. 63 of those are in critical care, and 38 are requiring mechanical ventilation today. Everyone else has recovered. Sadly, 12 people have died as a result of COVID-19 over the past 3 days. My condolences to all those who have lost loved ones. Since the last report, 2 new outbreaks were declared, one at Kelowna General Hospital in Interior Health and one at Glenwood Seniors Community in Fraser Health. The outbreak at Sunrise Poultry has been declared over since our last report. These negative outcomes, these losses, are an important reminder of what we have to gain. For the past 16 months, all of us, public health teams, frontline workers, frontline healthcare workers, and all of you have been thinking about preventing negative outcomes, preventing losses. We've been focused on preventing serious illness, hospitalizations, and deaths. Orders and restrictions are part of our daily lives. But now we are in a much better position as a province, and we can start to focus on all there is to be gained through immunization. And there's so much. If we keep going, we can get back to the things that sustain us, back to our communities, back to work, back to the meaningful relationships in our lives. And as we move forward, our public health monitoring and management will also change, and I'd like to share some of those details with you so that we can gain a shared understanding of what those changes are and why they're happening. As cases continue to decline, daily fluctuations, especially in cases, will be less and less meaningful. Rather, 7-day averages and long-term trends are going to be better indicators of our progress. From a public health perspective, as long as we continue on this trajectory, we will be aiming to shift our approach from pandemic emergency response to a sustainable public health management. This approach is actually similar to how we prevent and control other communicable diseases. In BC, strong local public health teams of public health nurses, environmental health officers under the leadership of medical health officers monitor, prevent, and control communicable diseases every day. Indeed, normally they do it so well that we rarely hear about them in the news. What we can look forward to in an immunized population is that COVID-19 will become one of these communicable diseases, the one that is a disease that is effectively and expertly managed by public health and the healthcare system. It also means public health teams can return to some of the other equally important work that keep us well, to prevent overdoses, to prevent injuries, and to reduce health inequities in our population. We are on a good path to get back to work, to school, to university, to seeing friends, to traveling, resuming those connections that are so important to all of us. But to get there, please register and ensure you are fully vaccinated so we can all put this pandemic behind us. Thank you for your time.
That's Dr. Gustafson, and I want to start by passing on my condolences to the 12 people who passed away over the last 3 days, 9 from Friday to Saturday, 1 from Saturday to Sunday, 2 from Sunday to Monday in British Columbia related to the COVID-19 pandemic. 8 lived in Fraser Health, 4 in Vancouver Coastal Health. And these are difficult times, especially now, especially through 18 months of the pandemic, I think, for people to lose loved ones as a result of the COVID-19 pandemic. Their remark, I think their message about the force of the pandemic and the force of this virus on many people still in our province, and the need for us to continue to take actions to stop the spread of COVID-19, but mostly it's a moment of grief for the families, for the friends, the caregivers, and I want them all to know that we are with them today in what is a very, very difficult moment. Obviously, the overall news on vaccination continues to be good. We had a very strong weekend of vaccination. I think on or around 146,000 doses over the last 3 days, including the weekend days, and significant number of those now, of course, are second doses. Just say that in terms of first doses, that over 70, about 88% of people have received their first dose, over 65, 86%, over 60, 85%, over 50, 82% for the first time of all of those people over 40, which is a huge group in British Columbia. 80% now have received their first dose of immunization, and 77% over 30. Of course, over 18, all adults, it's 74%, and all those eligible over 12, it's 72%, 121,058 people. Children and youth between 12 and 17 have received their first dose immunization in the relatively short period of time in which those doses have been open to them. A sign, I think, of the determination, especially of young people, to get vaccinated. And that's something we want to, of course, continue to encourage. With respect to hospitalizations and critical care, we see that the number of people in hospital is now under 200 at 199. At its height of the third wave, that was 511. The number of people in critical care up slightly over the weekend is 63. That's down from 183 at the height of the pandemic. As Dr. Gustafson has said, however, it has this reduction in the number of COVID-19 cases in hospital doesn't mean that the healthcare system isn't incredibly active. In fact, if you look 2 weeks ago, we have fewer vacant base beds in our healthcare system today than we had a couple of weeks ago. I noted to you on Thursday that June the 2nd was the highest day of ambulance calls in the history of the BC ambulance system, other than New Year's Eve 2017 to New Year's Day 2017 and 2018. In other words, the healthcare system is incredibly active. We had 2 weeks ago 672 vacant base beds, and today we have 619 vacant base beds as overall COVID-19 hospitalizations have declined. So people are doing and continuing to do extraordinary work in our healthcare system, and as our society comes back to normal, we may well see more of the events that lead people into emergency rooms in our province. Through the weekend, we saw some of that on some news programming and print reporting. We've seen images of Surrey Memorial Hospital and doctors, nurses, and other specialist caregivers and support staff, tired, worried, and concerned that there were still many COVID patients in their ICU. For the past several months, and the past few weeks especially, our message to register, book, and get vaccinated has been relentless. You've heard it everywhere, and it's been shared by community leaders across BC. And we've done this because COVID is relentless. Since COVID became a household word, we've seen the nightmare that is global pandemic. We've seen the show of COVID's resilience in each jurisdiction's fight to stop the spread. The illness, the death, the sacrifice, the profound loss. We've seen how we adapt And with a virus that lives to spread and spreads to live, we've seen how it adapts too, through variants and the worrisome variants of concern. With each wave, we've seen efforts to get back what we can of what we've lost, to reconnect, renew, and resume our lives. And with the launch of BC's Restart Plan 2 weeks ago, we're doing that again. In BC, across Canada and around the world, that is our very human nature, to start again, to rebuild, and to move forward. But our duty to stop the spread has not ended. COVID-19 has sent us no message of surrender. We know it's essential that we register, book, and get our shot, to do it now, and keep with it as we're directed to do what's next. And we do that knowing, never forgetting, that the vaccines are highly effective, but not 100% effective. So we must register, book, and take our first and second doses, then still use our COVID skills, still follow the guidance we've been given, and still adhere to the orders that help manage the risk that exists in the gap between highly effective and 100%. We need to continue to work together. I'm so proud of so many communities that have significantly increased their immunization and registration in recent weeks. And we got to keep working there. Communities such as Richmond, such as Rutland, such as Fort St. John, that are seeing their immunization rates rise. And we've got to continue to do that in the coming weeks. It is a very, very positive situation.